Hi everybody, let's talk about healthcare. What is healthcare? How's healthcare working for us? This is a question that I've gotten asked to me in my practice many times over the 27 years that I've been helping folks. Healthcare is about restoring normal function. If you want to look up the word health, look in Dorland's medical text. It describes as functioning at 100% and not merely the absence of disease or infirmity. Folks, the somatics is when you get away from definitions. The somatics is when we start putting our own spin on it. So that's why in my office we talk about the nuts and the bolts of things. Let's get down to the basics. What are we talking about and what are we dealing with? Now, when it comes to your body is self-healing, self-regulating, meaning that your immune system is so much more powerful than anything that we can create or make as human beings. We have to understand that. And if we take out the roadblocks that prevent the immune system from working the way that it should, you will be healthy and very few things will affect you. Not everything, very few things, meaning there are some things that will present a challenge that could cost you your life. So this is not an all or none. So I always like to say, let's go back to Anatomy 101, folks. And here we go. At the point of conception is when life starts. That's a baseline. At that point in the road, something occurs that creates an entirely different path. Point of conception is when life starts. There are 11 systems to your body. 11. There's one system that controls and regulates the other 10. So wouldn't you agree with me that that one system is your priority system? Yes. What is that system? It's your central nervous system. So at the point of conception, cells start to multiply. They develop a zygote. That zygote looks like a tadpole. It's got a bulb and it's got this little tail that comes out the back. That bulb is your brain, that tail is your spine. Your central nervous system is the first of the 11 systems to develop because it needs to tell the other 10 what to do, and it needs to organize the orchestra called your human body's function. Therefore, from the brain and the spine, everything else comes. Your brain communicates with your body primarily through the nervous system. It can communicate through chemical, but the information to tell it what to do and what not to do, when to contract, when to relax, when to secrete an enzyme, that occurs at the central nervous system. Your body being self-healing and self-regulating. If you give the body what it needs, it will heal, it will fix, it will regulate all on its own. So then, what are we talking about? When we're talking about healthcare, 85% of healthcare is chronic disease. Chronic means that it builds up over time. Chronic means that it's something that you're doing in your lifestyle that keeps adding to the negative outcomes that we see in chronic disease. 10% of the time it's acute issues. Acute issues meaning sports injuries, car wrecks, those types of things. 3 to 5% is genetics. And you notice I said 3 to 5% because we now know this thing called epigenetics. Epigenetics talks about how your lifestyle will turn on or turn off your genetic makeup. It makes the telomeres of your DNA longer or shorter, which means it allows your telomeres, your DNA, to be more expressive or less expressive. This is from your lifestyle. 85% is from your lifestyle. Genetics do hold a key. There is no doubt about that. But if you have a family history of lung cancer and you decide to start smoking, you're turning on that gene. You're dosing it with gas and saying, try me. And it'll respond. It'll respond. Also, on a very small percentage, if you have a genetic tendency for lung cancer, you may develop lung cancer and never been exposed to these things. That is quite possible. There is no denying that. So when I was in my undergrad work in the mid to late 80s, and I was studying anatomy, I studied what is normal. Because when I looked up the word health, it says functioning at or near 100%. So the true job of a physician is to get a patient functioning the way that they're designed to function. Now that doesn't mean that your body is lacking a chemical. It may be lacking a vitamin or a mineral, but it's not lacking chemicals. And it's also not lacking organs. Or we have too many organs and we can just take a few out when they don't work right. This, folks, goes back to how your body functions. And that's why I became a chiropractor. I became a chiropractor because the point of chiropractic is to restore your body's normal function. It's not to treat pain. It's not to treat illness. It's not to treat or manage disease. It's to restore normal. And the one system that I work primarily with is the central nervous system, because that's the system that controls and regulates the other 10. And without it, you're putting the cart before the horse. And that doesn't make sense. Another interesting point is your body will manage these symptoms. It will manage its own challenges without giving you a symptom like pain, until it reaches a threshold of roughly 60%. And then the body will give you a symptom such as pain. So many times this is why men have different healthcare outcomes than women, because men wait till we have a symptom and then we say, well, maybe it'll go away. And then we use some over-the-counter medications. So at 60% is when you first get the symptom, and then you stick your head in the sand, and then you try to cover up the symptom, and it runs up to 70 and 80%. And if you do that long enough, you're going to have major problems. That makes sense, doesn't it? And this is our healthcare paradigm, and this is the challenges that we're facing with healthcare. We're in a time of COVID, we're in a time of panic, but we as chiropractors focus on restoring normal function, giving the body what it needs so that it can do the fighting. If it's a virus, the thing that's going to support you, the thing that's going to lift you up, the thing that's going to heal and protect you is your immune system. We know that because vaccines do not have a good outcome rate when it comes to viruses. We know that too. Look at the flu vaccine. So when you're looking at healthcare, it makes more sense, it's very logical, to restore the body to normal function. And that's what we do as chiropractors. And we start with the nervous system. So I love analogies in my office, because analogies are a way to look at things that make sense to you while we question this thing called chiropractic. So a good friend of mine and I were just talking about a car that he purchased about 6 years ago. And we were talking about changing the oils on a regular basis and using synthetics. Yet, if he never changed the oil and that engine blew, you're looking at about an $8,000, $9,000 engine. But you could take the old one out and put a new one in and you're back in business. That's not how your body works, folks. You got to take care of your body. And you have to have measurables. You have to have functional assessments. All right, Dr. Tim, what's a functional assessment? How many of you have heard of a stress test? Now, there's two ways to perform a stress test. One is chemically induced, but the most common is to get on a treadmill, arch it up, and see how the heart responds to a functional load. This is what we do in our office. Whether it's blood tests, whether it's x-rays or ultrasounds, we put a load on the tissue, we see how the tissue responds, and then that tells me how I need to restore function. Critical pieces, folks. So when you look at going to a chiropractor, half of you want to go to a chiropractor because my back hurts, I have headaches, my neck hurts, I have joint pain. And that is a driving force, but you have to realize that you're basing your decisions on that 60% mark. You're basing it on, I've lost 60% function. So that means that when I get adjusted and the pain goes away and the symptoms go away, I must be back to normal function. And the answer is no, folks. You went back to 60% loss. And that's half of chiropractic. And this is our struggle as chiropractors, is to educate the masses. Because in your body, every cell has a nerve that goes to it. Most are direct nerve innervations, some are indirect, like blood flow. That's an indirect innervation. So if you're looking at your hearts and your lungs and your kidneys and your spleen, all of these organs must be told by the brain what to do, when to secrete, when not to. Your brain will control that. How do you think it's going to communicate with that? Through the nervous system, through the central nervous system, through the cranial nerves. This is how it functions. How do you know when that nerve is pinched that goes to your kidneys? Folks, you don't. You don't. But we as chiropractors take functional films where we have you standing and then we have you moving to see how your spine is functioning. Because we've been trained to detect when a bone is out of position, wherever that nerve is going to lose neurological flow. It's going to lose innervation. That's how we know where to adjust. Exam is another way to know where to adjust. Palpation, to feel where things are not moving the way they should. That tells us where to adjust. The other half of chiropractic, folks, and to give you a quick reminder, one half is pain. The other half is normal function. I want to make sure that my heart palpitations is due to neurological flow, electrical flow. I want to make sure that from my brain until it leaves the spine, that the interference is not at that point in my body. We are not advanced enough in technology to know exactly how to pinpoint that point. We don't have the tools, we don't have the diagnostics yet for that. But what we do have 125 years of experience of working with people and on people to know what outcomes we can expect based on our assessments, our functional diagnostic assessments. So half of chiropractic is going to be biomechanical and pain, and that's what everybody accepts. Chiropractic works great for headaches and low back pain and mechanical issues. Yes, it does. But chiropractic also is phenomenal with infants with ear problems and ear symptoms, earaches. It's phenomenal with people with upper respiratory and sinus issues, which is one of my conditions that was treated through chiropractic. It's excellent with folks, mainly women, with thyroid issues at C7, T1. The nerves that come out there go to your thyroid. At T6, those nerves go to your stomach. So folks with stomach issues. You see, folks, chiropractic is not just back pain. We do great with that. But what chiropractic truly is restoring the communication, taking out the interference between the brain and the body, and that allows those tissues to function the way that they're supposed to function. And in doing so, your symptoms go away. That's chiropractic. It's just not that easy to measure. So folks will say, well, then you just must believe it, Dr. Tim. No, I see it. In 27 years of practice, I've seen it repeated over and over and over. And I hear this many times about believing in chiropractic. Folks, how many of you love someone? I have a wife that I adore. I have 4 kids and 5 grandkids that hang the moon for me. And I love them more than life itself, and I would give my life for them. But the Bible tells us that's the true measurement of love, is if you're willing to give your life for someone. But is love measurable? No, love is not measurable, but we all know it exists. The reason chiropractic is not a belief system, the reason that it is objective, is because of the word paralysis. When you have a spinal cord injury, folks, and you're paralyzed from that point of the injury down, Do you believe that? Or is it objective fact? It's objective fact, meaning 100% loss of nerve flow equals paralysis. We know that's fact. Let me pose this question. If the vertebra misalign and is compressing 50% of the nerve flow, so that means half the nerve is compressed, not 100%, but 50%. Wherever that nerve is going, whatever tissue that's going to, will you see a decrease in nerve flow to that tissue? Yes. And will you then see a symptom because of that decreased nerve flow? Yes. And what we see that as is symptomatology of that tissue contributing to chronic disease. That is the true picture of chiropractic. Step one, biomechanical issues, symptom management. I get that, folks. That's how I became into the profession as well. I came in because of symptom management, pain. But what I found is that the more I got adjusted for a low back problem, I was being relieved of headaches. I was being relieved of chronic sinusitis, chronic upper respiratory issues. And after 2 or 3 years of being adjusted and not having those things that I had in my entire life, I started looking at it a little differently. My 35-year-old daughter, my oldest daughter, who I just adore, she was 1.5 years old. They wanted to put tubes in her ears and take her tonsils out. And I'll do anything for my kids. I started getting her adjusted, and the response in her body was immediate, and it was huge. The infection was gone within days. The symptoms were gone within hours. She responded so well that I kept getting her adjusted. And I could see other things within her body that kept responding. So I kept getting her adjusted. Those are the types of things that I see daily in my practice. I see people responding in ways that they never came in the office for. People come in the office for neck pain and low back pain and carpal tunnel and headaches and all those types of things. People leave seeing that their numbness is gone, the radicular symptoms are gone, their kidney function and labs are back to normal. They don't have any sinus issues anymore. Folks, chiropractic doesn't treat symptoms. It restores normal function. We look at things from a different perspective, not a right or wrong perspective. There is always a time for everything, such as medications and surgery. There is a time for those things, but not every time in every place. There needs to be a system implemented that helps you manage your health instead of managing disease. Because folks, you're going to spend money on one or the other. You're going to spend money to manage your health, or you're going to in time spend money to manage your disease. But when you spend your time and your money to manage your health, it's your choice. It's your choice what you're doing. In this time of COVID, what we're seeing is that a high percentage of patients are presenting with vitamin D deficiency. And we see that every year during the flu season, even knowing now the flu season is gone. It's replaced by the COVID season. There's certain things that we see on a regular basis when it comes to chronic illness and chronic disease, or seasonal illness and seasonal disease. So I encourage you, this is coming up on the New Year's, and I'm going to do a video here shortly about resolutions versus revolutions. Stop with the resolutions. Make the choice to have the life that you want. Sit down before the new year and write out, what is it that you want? Relationships, your relationship with Christ, finances, career, and your health. Folks, those are the big five. Write them down. Create goals and follow up on paper every week. You deserve these things. But you're going through life at such a rapid pace that you're not stopping and analyzing and staying on track. If you lose your health, what have you got? If you lose your health, what have you got? It's going to cost you a lot of money. The number one cause of bankruptcy is healthcare costs. It's going to be a stress on your marriage. It's going to be stress on your relationship with your kids. Many different sicknesses, you're out of work for a long time, if not forever. Folks, 85% are chronic diseases. That means you have a choice. At some point in the game, you have a choice. Step up. Make different choices. Look at this from a different lens. Look at this from a different perspective. But it's your choice. And while America is still America, you have a choice to look at it different. You have a choice to attack it differently. And I encourage you to do so. Don't look at your body as being the victim. Don't look at it as, I'm going to hibernate because I don't want to come in contact with something. Make the choice to get healthy, be healthy, stay healthy, so that you can live a life, serve your family, serve God, serve your community, and not have to worry so much about this sickness and this disease, that whether it's COVID or something else. Take control, make good choices, and achieve the life that you deserve to get. Stay tuned, folks. We're coming right back at you with some more things that are going to help you improve your life.